Tumpigie makofi Dr. Sigilai ambaye tumesema hapa na Alex Munyere na Jane wa Mogo, nasikia siku hizo unaitwa Monyu mpaka nashangaa kama ni mtu mwingine. Kwamba ni jina lake, ni vile mimi sijazoea hilo. Kwamba huyu ni mwenzetu. Na tukisema sisi ni mwenzetu nasema watu wenye ulemavu. Watu wenye ulemavu, hoye! Nyinyi mnakaa kama mjakunywa breakfast. Watu wenye ulemavu, hoye! Wewe ukikataa hivyo utafanywa screening wewe ukikataa kufanya hivyo. I am very happy to stand before you here today, and I want to recognize the CEO, acting CEO of the KNH, Dr. Sigilai, who has spoken very well in Kiswahili. Ni kweli mimi ni mpenzi wa lugha na huwa mara nyingi sana ninashukuru wakati naona watu wanazungumza hii lugha kwa ufasaha, kwa sababu nafikiri watu wengine wanasema sijui Kiswahili sio mdomo changu. Nani alisema sio mdomo chake? Kwa hivyo asante sana kwa sababu ya hilo. I also want to recognize Dr. Choksi for being here. She's been always with us. She was there when we started the Albinism Society of Kenya in 2007. Formally, we had started in 2006, the Kenya Society for the Blind there, but we launched it at Thika High School for the Blind. I remember that event very well. And also my good brother, Alex Munyere, my brother and friend. We are, between me and him, we are like Paul and Timothy. I don't know who is Paul and who is Timothy, but he's older than me. We are the two people really, and it's good to say what is the truth, who have sustained this albinism cause from an advocacy point of view. He was a founder, chairman of the Albinism Society of Kenya. I was his vice chair, and also the national coordinator. Also, I want to recognize Dr. Munene for heading the ophthalmology department, but also Dr. Wanyika, who really is the one we come to here on skin cancer. Today she's in green, is it? No, I'm not colorblind. In blue, and she looks younger, by the way. Whatever you are doing, continue doing it. And also Jane Wamogo, who we worked together as and founded the National Council for Persons with Disabilities. And it was a challenge to work with Jane because that time albinism was not well understood. I am actually the one who insisted it be part of the disability categories. It was a lot of resistance. In fact, I remember her asking me whether it is a condition or a disability, because we suffer from what we call in-betweenness. Black but not black enough, white but not white enough, disabled but not disabled enough, blind but not blind enough. Tuko hapo katikati hapo. But then that is who we are. Black people with a white skin, if you can say so. But of course, you also find people with albinism in Japan. I was there sometimes back. They were telling us how they are forced to dye their hair to look the part. I also want to recognize all of the people who are here, all the workforce. And I recognize that majority are women. Let's clap for them. Majority are women, so we are our mother's children. Majority of us have actually been raised up by women. I am also a son of a single mom. So we recognize you. I remember even the first doctor who was dealing with the case of Agnes Mudaki here, Dr. Sigilai, was Dr. I think Abdallah. Dr. Abdallah, she was a dermatologist that time. But also we are happy that also here at KNH we have one of our own, James Moyai, he is here. So here we can also be clinical officers, we can also be doctors. And of course, we are very proud of you, Dr. Sigilai, because you encourage that persons with disabilities can also rise to become CEOs of state corporations or level 6 hospital, the oldest and the most powerful Kenyatta National Hospital, aka King George, ama Kigani hiyo, ile ya kitambo. Now, before I proceed, it's only fair to recognize persons with albinism who are there. Please stand up where you are. Tusimame tuwapigie makofi. Simameni, asanteni sana kwa kuja. Thank you very much. You can be seated. I think all of you were mobilized, or many of you were mobilized by Daniel Omeno. Where is Omeno? Please come here, Omeno. Tupigie makofi akikuja huyu Omeno. Omeno is our programs manager for the Albinism Society of Kenya. Hawa ni watu wako ama wetu, si ndio? Ongea kidogo, ongea kuhusu hii organization ya ASK.
Thank you. My name is Daniel Omeno. I work at Albinism Society of Kenya. And I'm happy to be here. Albinism Society of Kenya started in the year 2006. And we have done a lot in terms of awareness. We have programs that we normally do. We have Linda Ngozi, Linda Afya. We have education support for children with albinism. And we also have other programs like Nisikilize. This is counseling, whereby we counsel mothers or parents of children with albinism. And they normally come to the office. Once they get these children, they are vulnerable, they don't know what to do, and we are there to support them, psychosocial support, and it has really helped them. And today being one of the days that we celebrate albinism awareness, I'm happy to see all of you here, all persons with albinism who have come today. I really appreciate you, and as we join hands together to celebrate this day, I would like to urge you, all persons with albinism across the country, to take care of yourselves. Make sure you put on long-sleeved t-shirts to protect you from this skin cancer. We all know that skin cancer is a deadly disease that kills persons with albinism, and it is costly. And I urge Kenyatta Hospital to at least take, when we get a person who is diagnosed by skin cancer, there are those procedures that we do take here in Kenyatta Hospital, and sometimes people die before reaching the doctor. At least there can be a system whereby when we get these persons with albinism who are suffering from skin cancer, there is that procedure that they'll be assisted. Thank you so much, and may God bless you.
Tupigie makofi Bwana Omeno. What he didn't tell you, Alex was sharing with me how recently the National Council for Persons with Disabilities had to pay over 400,000 shillings to accommodate someone who had come to seek treatment here at the Kenyatta National Hospital. But what Omeno will tell you, I have not treated him very well as the current chairman of the Albinism of Kenya, because for many years, every time we had a patient who needed to come here at KNH, he was the one who was accommodating them. He had to literally live with them. At times I even had, Maina is here. Where is Maina, my PA? Stand up, we see you. Ndio huyu. Keti chini, tumpigie makofi Maina hapo. He's my head of programs at the Office of the Government Spokesperson. We have had to accommodate people with albinism. Sorry to say this, but who have very serious wounds that are smelling. Some of them, of course, they have gone all of the way. By the way, skin cancer sio rahisi vile unaisikia. It is the one that causes, it is the number one enemy for persons with albinism. It is the one that causes us to die prematurely. Skin cancer is the one that you hear many people saying that many of us do not reach the age of 40. But we thank God because of the fact that now, with the protection, with sunscreen, and I'm happy that Nivea company is here, because that is the number one sunscreen provider for people with albinism. We established a partnership with them way back in 2013, and it's ongoing now. They supply the government takes to the hospitals. Now, people are able to live longer lives. And Alex, if you allow me, kwa sababu wewe ni ndugu yangu mkubwa, if you see Alex here, he's now, is it 60 or 61 years? 61 years. Tupigie makofi. Now unaona he is very strong and all of that. So we have now people with albinism living longer and better, as long as you have sunscreen, you protect yourself and all of that. Hata mimi mwenyewe watu wakiniambia tumekuachia jua, mimi nakuwa nikiwaambia niko na kofia, niko na miwani na niko na sunscreen. Na ikiweza sana unachukua mwavuli. So hiyo nayo tuambie tu kweli hapo. Now this day is very important for us. I don't want to talk a lot because it's our day, and also we'll have, just for the public, it's good we know. We are going to have our celebration on Friday in Eldoret at Huruma Primary School. And the chief guest is none other than the First Lady of the Republic of Kenya, Mama Rachel Ruto. So let's clap for that. And we invite all of us. So this is a build-up activity. We'll also have other screening also in Eldoret. And other activities. We'll also have many other counties that will be celebrating. That's a national celebration. So invite you, persons with albinism, your parents, the allies of people with albinism, companies, and also the members of the fourth estate to join us on Friday. In fact, after this, I am going straight to Eldoret together with Alex and the team so that we can organize properly. So we really want to say thank you for KNH for this build-up activity. And why do we say thank you? It's because for a long time, the issues of albinism were left to us to deal with. But right now, we are celebrating 10 years since we started this International Albinism Awareness Day. And because of that, we are happy. We are happy because now it has been mainstreamed. Otherwise, Alex will tell you that in 2010, 15 years ago, we had to force then PS for social services, who was also a former PS for medical services or health, Dr. James Nikal, who is now the MP for Seme, third-term member, we served with him in the National Assembly, to actually forcefully hand over sunscreen that we had gotten as a donation. And we queued people with albinism, while other people with disabilities were receiving wheelchairs and other assistive devices. But today, in 2012, while I was a student at the University of Leeds, I came up with a concept paper that has since become government policy, whereby 3,800 people with albinism, every month, they receive free sunscreen lotion, lip care, and after sun. So now it is a government program, 3,800. So it's no longer a personal endeavor. Also, that same program, according to that concept, we've also been able to do a lot of awareness creation. That is how we also started something that we may be aware called Mr. and Miss Albinism. Job placement, and we've been able to place persons with albinism in various companies. If you see anyone working in Carrefour, Absa Bank, Safaricom, and many others, really, they have passed through our hands. I was pleasantly surprised on Sunday, as I was boarding a plane to Mombasa. The person that I met to check me in as a KAA was a young man with albinism called Mutethia, and he pleasantly reminded me how the Albinism of Kenya supported his education when he was in high school. Those are the stories that we have. Recently, about 2 years ago, we had a challenge because persons with albinism had been denied admission to work at KRA because they required paramilitary training. But thankfully, in 2015 as well, 10 years ago, I had started a program with the NYS so that we had many youth with disabilities, albinism, majority actually are deaf, and those with mild physical disabilities and those of short stature have been admitted as NYS recruits and now graduates. I think we have over 300, if not more, who have since graduated. And so the 5, because of that, are now working with KRA as revenue service assistants. So we have made progress. We have made progress to the point that the face and voice of government is a person with albinism. I mean, that is a great achievement. Yeah. Otherwise, it was inconceivable. Some few years ago, Dr. Choksi, because we are people who earlier on, like when I remember when I joined politics, people would shake my hand and then they wipe their hand like this. They think like albinism is contagious, and they would do it subconsciously. Unasalimia mtu alafu unaona amejipanguza hivi. You know, thinking that then maybe this is something that sticks into your hand. But now people appreciate. I see many people with albinism in many areas of life. We even have a member of parliament now who was our first employee at ASK, MP for Webuye, Martin Wanyonyi Pepela. We have a 2-term MCA, Aseka also, who was one of our employees, actually the first 2 employees, the 2 of them. And counting, we have now Justice Mombi Ngugi, who is a Court of Appeal judge, who was our founding treasurer. Alex, you remember? We actually had to look out for her when she was in the private practice and told her to come, because we were 3 men. I had to step down for her so that she can become the woman out of the 3 officials, Alex, and Isaac, but then Isaac stepped down to be vice chair. And so therefore, we have made good progress. The people who come from Meru, you know Kamano, He is very well known. He's a musician. In fact, he's a king of Meru music. We now have even, people in almost all walks of life with albinism. So we are here to celebrate as per the theme of demanding our rights, protecting the skin, and preserving our lives. Demanding our rights, protecting the skin, our skin, and preserving our lives. Let me repeat that again. Demanding our rights, protecting our skin, preserving our lives. That is the theme for this year. And the key activity that we are going to do is to do skin cancer screening, and I am going to be screened as well. I also want to be lead by example. So nitaingia hapo hata mimi niangaliwe. We are supposed to do skin cancer screening once every year so that we can treat this very early. As Dr. Choksi said, it is the easiest to treat. With about 3, 4, 5, 6,000 shillings you can. But then when it is not treated, you can hear Alex saying that we are just about to, money has been worth 800,000 to KNH for the treatment. Because the concept that I came up with in 2012, part of it was skin cancer treatment, the other one was protective clothing. So you see many people with albinism, their headgears, their long sleeves are actually that which we have given through that program of the council. Because private sector or civil society is not very sustainable. However, I'm very happy because of two issues. Number one is that we now have the new Persons with Disabilities Act 2025 that fully, entrenches our rights. One of the things we were discussing with Dr. Sigilai is that now you don't have to keep on renewing your certificate when you are a person with disability, with a permanent disability. Hiyo inatusaidia sana. Kwa sababu tulikuwa tunajiuliza, kwani utakuja mara moja uponde uanze kutokuwa na albinism ama uache kuwa na ile ulemavu mwingine. Now that is permanent. And I'm happy. Maybe for temporary disability, it should be renewable, because that has been the biggest issue. You finish 5 years because you are so busy, then you lose some income because of tax exemption. The other thing that also we can say is that, of course, people with disabilities are going to be entrenched in the digital economy. It's very clear. And also, caregivers of persons or children with disability can now apply for tax exemption. That is very, very important. And especially for mothers of children with disabilities. Personally, I'm very happy because most of them are the ones who are caregivers of children with disabilities. Of course, even our fathers, so that I'm not accused of being gender insensitive. The people who have to take care of children with disabilities, but are still go out there and work, at least now you can also apply for tax exemption. And also, the other thing that is also very important is to ensure that also when it comes to elections, there is now secret ballot for those who are visually impaired and other types of impairments, so that nobody takes away your right to vote. You can vote and say who you want to have on board as your leader. And also, there's something that is very critical, because as a government spokesman, if I don't speak about this, I'll not have done my job, is the fact that now as we speak, the 5 pillars of the better plan, there are some people here who are asking, 1,000 days, what has President Ruto done? I will want to answer you by telling you there are 1,000 things that President Ruto has done in 1,000 days. In fact, we have never had a busier president than him. Let's clap for him. I mean, he deserves that. And if you don't want to clap, I'll tell you why. I'll tell you why, because Taifa Care is now working. Taifa Care is now working. This morning, I was getting the brief from my team. The people who have registered under Taifa Care, SHA as popularly known, is 23.3 million Kenya people. 23.3 million. That is record. The defunct NHIF had only 8 million people, but now we have 23.3 million. We know we have a legacy debt that was accumulating up to 39 billion Kenya shillings. That is being sorted out by the technical committee, but most of those pending bills were fictitious. There were people who are gaming the system as to swindle the public. That is why you no longer hear them making a lot of noise, because they know that they have been caught, stealing from the public. But under Taifa Care, under SHA, we have been able to pay now as a government over 43 billion shillings. And we are trying our level best to ensure that we pay by the 14th of every month. What we are encouraging Kenyans to do is, if you can, please pay the whole yearly premium at a go, if you can. Because it's not a lot of money. It's from 300 shillings going up for those ones, because we are seeing some people who just pay when they are sick and then they don't stop paying. However, we also recognize that it is a challenge for you to have all the money. If you are faithful enough as a Kenyan, and there is that program now, the president launched it during Madaraka Day, Lipa SHA Pole Pole. Lipa SHA Pole Pole, Lipa SHA Kidogo Kidogo. And you can actually apply from the Hustler Fund so that you can pay your one-off yearly. That one is also a program within government. So I know that is something that has been a challenge, but we want to really clarify, if you have a problem paying that one, apply through Hustler Fund, and then you'll be able to pay at a go, *254#. And then what do? You are able now to pay at a go. But then, kama unaweza kalipa SHA pole pole, that program is there. And we encourage our hospitals. We even saw the RUPA, the people from the Rural Hospitals Association. We also saw the religious, institutions, the mission hospitals. Now they are happy because they are being paid on time. Of course, as a government, we have allocated 3 billion shillings from the Primary Healthcare Fund, and another 3 billion for the Emergency and Critical Care Insurance Fund. That one for this financial year. But the budget will be read tomorrow. So we'll hear the new allocations for the next financial year. That was on a supplementary, so that then we can cover levels 1 to 3, and then SHIF covers from level 4 to 6, and then ECCIF is for emergencies, both here and also abroad. And of course, we have the Digital Health Authority. All of these that are now working going forward. And if there is any labor disputes, we are ready and willing as a government to resolve them. But what I am happy about, as I conclude, is that now SHA, Taifa Care, is able to pay for skin cancer treatment for persons with albinism. We have heard from the horse's mouth that now the bills are being taken care of by SHA. And so therefore, these special allocations that we have had at the council maybe can go to other things, Alex, like accommodation and what have you. But yes, and also he's informing me, because he's a programs in charge of the National Albinism Support and Sanskrit and Support Program, NASP, that now the fund is also going to pay for the SHA premiums. Yes, as low as 300, isn't it? So kindly approach, if you are a person with albinism there, that fund now is being converted to pay for your SHA, for your Taifa Care, so that usishinde pia ukishinda utalipa. So approach, and I think that's one of the things we need to do, Dr. Wanyika, is to now help persons with albinism to register for SHA. If we can do that, we'll be very happy, Dr. Sigilai, because I'm sure you have an active registration process here. So maybe if it's possible, as we do the screening, kwa wale ambao hawajakuwa registered, pia waweze kuregister. Si ndio watu wangu? Si ndio? Tunakubaliana kwa hiyo? So hiyo ni maombi kutoka kwa ground, na ground imeongea, kwa sababu kwa ground mambo ni different. So I think I want to say thank you. I can see we are pressed for time, because we have to make at least 50 or more than 50 screenings today. The team is ready. I just want to say, tuendelee na moyo huyo. Let us work very hard and know that rights must be demanded, rights must be exercised, but also with responsibility. We must always protect our skin, because it is the greatest, master status, is a master status of our essence of being. It is the skin that people see and associate us with in terms of color. And also, we must also protect our lives. We must take care of our eyesight. I am very, very perturbed by the fact that the longer use of our smartphones is making those with albinism blind faster, Dr. Choksi, and we need to ensure that we increase technological protection for persons with albinism, because as you age also you lose your eyesight, so that then we maintain that. I have had to maintain my prescription glasses here for many years, because I realized the more I kept on changing the prescription, the more I became blind. This is debatable. I know, Dr. Choksi, we may not agree with you on that one. But it's something we debate, because sometimes it reaches a point where even when you have prescription glasses, they may not help as much. So we still need to do a lot in terms of having new technology that will really help the albinic eye that has got a poorly developed retina to still be able to see well. And there was some research that was done some times back. Some mice, there's some dye that would be applied, and they had albinism and they could see better. So we are waiting to see whether that can be transferred to human beings. Dr. Munene, I think that's a challenge on that research, so that we see the transferability, because those are maybe big guinea pigs or whatever, so that when we see whether there is also that dye, because the problem is the poor retinal development that of course makes the image at the back of the eye not be well developed, and so therefore become people who have short-sightedness. We also have photophobia and also nystagma. Most nystagmas and also astigmatism. There's a lot of conditions that go with our eye, but at least we thank God that we can see something. Also, Russia declared that they have come up with a medicine for cancer treatment. I think that was great news. Is it last year? We also would want to see our oncology department, and Dr. Wanyika, you're here. How far is that? And how does it help those with albinism? Otherwise, we made very good progress when it comes to apps that can help us to magnify, our fonts. When I am doing my briefings as a government spokesman, I usually use font 14 or 16, so naweza kuonea mbali hapo. So all of those things have really helped us. Otherwise, I would be squinting, and it would look improper when I'm trying to brief the nation. So all of those accommodation issues are important, so that we can ensure that persons with albinism live a dignified life. Long live persons with albinism. Long live persons with disabilities. Long live Kenyatta National Hospital. Let us protect our lives. Let us protect our skins. Let us demand our rights. Happy International Albinism Awareness Day. God bless you.